Hi, welcome back to Move365. This is Mark Kennedy from Winchester Spine Centre. Remember to click on the bio, go to the link for the YouTube channel to watch the full-length video, or go to youtube.com and search for Move365. Today we're going to talk about a slightly contentious issue amongst us chiropractors, the prescription of orthotics. Orthotics are little shaped inner soles that would go into your shoes. Let me show you. These are some rather tatty versions of my own. They are a plastic construction. This is a semi-flexible orthotic, and it's a shaped inner sole that provides a platform that comes up to meet your foot and gives you a solid foundation with the ground, supports the arches in your foot, controls some of the movement in your foot as you go from heel strike through that mid-stance phase and then toe off as you move on to the other leg. As I say, it's contentious. Many chiropractors will feel that they are unnecessary and in fact can interfere with your normal gait pattern, locking you into poor patterns of muscular behavior. Myself, I find that in many cases where we find issues related to feet and ankle dysfunction, they are not necessary. Once we get the joint movement right and we get the muscle function right, they're not necessary. But in some instances they can be useful, and so I'm going to show you how I prescribe them. I use a computerized prescription system. There are many ways to do it. You can have your foot pressed into little foam boxes. You can have people make plaster of Paris casts from your foot. I prefer this method because it seems to me to cut out a lot of the variables, and over the last 15 to 20 years I've been using this system on patients periodically and get really great results with it. A lot of patient satisfaction. Patients love these things. Maybe it's just the simple fact that you've got an actual sort of physical product that you can use, don't know, but it seems that they like it. So how does it work? Well, all you got to do is set up the software, which I've already done, and then walk across this force plate, and I'll show you what we get. So I just need to walk across the plate. And the machine is asking me to walk across this time with my left foot, so we're going to do it with my left foot.
Please stand still on the gate scan plate with both feet shoulders width apart.
Okay, I'm going to skip that section. And I'm going to show you what we get. So you can see that we get a little scan of the foot showing the movement of my foot from heel strike through to toe off. The red areas represent the maximum areas of pressure. The little red line just shows the weight distribution, whether I'm rolling out to the outside of my foot or curling in towards the middle. You can see on this right hand side how as soon as I come off the heel I roll in, and that's an element of pronation, rolling in towards the middle, and then I correct for that and come into the midfoot and then onto the toe. Here on the left hand side I do a similar thing, correct for it, and then when I get into the ball of the foot area I take a sort of sharp pronation over towards the first toe. Anyway, clever people at the company that makes this software will produce an orthotic from that data, and they will send it back to us, and then that goes into the shoe and away you go. Can be very helpful for activating muscle, which can help you to reduce pain in the body. Anyway, I hope that's helpful. I hope that's a little useful insight into how orthotics can be created. Whether or not you need them is a conversation between you and your therapist. Come back soon, because we're going to come back and give you more information about how to move well and stay healthy.